Every year, thousands of people unknowingly live with a silent threat growing within them: esophagus cancer. This devastating disease often progresses unnoticed until it's too late, robbing individuals of the opportunity to take action. While it's not as commonly discussed as some other cancers, the impact is just as severe. But what if I told you that recognizing just a few subtle warning signs could mean the difference between life and death? According to the World Health Organization, esophagus cancer is among the top causes of cancer-related deaths globally. Early detection can dramatically improve survival rates. I know what you're thinking. This can't happen to me. I'm too young, I feel fine. But the truth is, anyone can be at risk. Age, lifestyle, diet, and even family history all contribute to your susceptibility to this disease. Ignoring these factors and the early warning signs can be dangerous. In this video, I'm going to walk you through the 8 critical early signs of esophagus cancer, symptoms you should know. And to understand them, you need first to know the meaning of esophagus cancer. Esophagus cancer attacks the esophagus, the long, hollow tube running from your throat to your stomach. The esophagus is responsible for carrying food and liquids from your mouth to your stomach. Esophagus cancer typically begins in the cells lining the esophagus and can grow unnoticed for months or even years because of its silent and gradual onset. When a tumor develops in the esophagus, it starts as small, abnormal cell growth, which might not be detectable in the early stages. Over time, the tumor can grow and obstruct the passage of food. As the tumor expands, it can also spread into surrounding tissues, making it difficult for the esophagus to function normally. This gradual growth and spread are what makes esophagus cancer so deadly. Many people don't experience obvious symptoms until the cancer has reached a later, harder-to-treat stage. That's why you are here. Let's jump to the first sign: trouble swallowing, dysphagia. Trouble swallowing, medically known as dysphagia, is one of the first signs of esophagus cancer. It begins when food, such as bread or meat, feels stuck in your throat or causes pain when swallowed. As the tumor grows larger, it starts to block the esophagus as it grows. As the cancerous cells proliferate, they form a mass that narrows the esophagus, making it hard for food to pass through. In advanced stages, the tumor can completely obstruct the esophagus, making even liquids like water or tea difficult to swallow. This obstruction happens as the tumor invades deeper layers of the esophageal wall, restricting its ability to expand and contract as food moves through it. Sign number 2: mysterious weight loss. Unexpected weight loss is a red flag for many cancers, including esophagus cancer. As the tumor grows in the esophagus, it causes a blockage that prevents food from moving easily down the tube. This, combined with the body's increased energy demands to fight cancer, can lead to a significant loss of weight. Tumor cells consume large amounts of energy, depriving the body of essential nutrients and contributing to unexplained weight loss. If you've unintentionally lost 5 to 10% of your body weight within a short span, especially without a change in diet or exercise, it could be a sign of cancer. This weight loss typically accompanies other symptoms such as fatigue and muscle weakness. Sign number 3: constant heartburn or acid reflux. Frequent heartburn or acid reflux may seem harmless, but constant reflux can indicate a more serious problem. Stomach acid reflux occurs when the lower esophageal sphincter, a ring of muscle at the bottom of the esophagus, becomes weak or relaxes improperly, allowing stomach acid to enter the esophagus. Over time, this acid causes inflammation and irritation of the esophageal lining. Chronic irritation increases the risk of genetic changes in the cells lining the esophagus, leading to conditions like Barrett's esophagus. This abnormal cell growth is considered a precursor to esophagus cancer, especially if left untreated. Ignoring frequent heartburn is dangerous. It's not just uncomfortable. Persistent acid reflux can transform into something much more serious. Sign number 4: chest pain or discomfort. Chest discomfort can be indicative of cardiac issues, but it can also be a symptom of esophagus cancer. The growing tumor in the esophagus can put pressure on nearby structures, including the chest cavity and heart. As the tumor expands, it irritates the surrounding tissues, leading to pain that may feel like burning or tightness. This discomfort can be mistaken for heart-related issues, but it's essential to consult a doctor to rule out cancer, especially if the pain occurs alongside other symptoms. Sign number 5, chronic cough or voice roughness. As the tumor grows in the esophagus, it can invade the surrounding tissues, including the airway and vocal cords. This invasion can cause a constant cough or a change in your voice. The tumor's growth obstructs normal airflow, leading to respiratory issues like a persistent cough, or it may interfere with the vocal cords, causing roughness or hoarseness. A cough that lingers or unexplained changes in your voice can be more than just a seasonal cold. Sign number 6, vomiting blood or blood in stool. Tumors in the esophagus can lead to internal bleeding, either through the rupture of blood vessels in the esophageal walls or through ulceration. When the tumor erodes through the esophageal lining, blood may appear in vomit or stool. Vomiting blood can be an alarming sign of cancer or severe bleeding in the upper digestive tract, while black, tarry stools often indicate bleeding lower in the esophagus or stomach. Any sign of blood in your stool or vomit requires immediate attention. It could indicate the spread of the cancer or other severe gastrointestinal conditions. Sign number 7, persistent fatigue and weakness. Cancer can drain your body's resources, leaving you feeling unusually tired and weak. Tumors require a significant amount of energy to grow and metastasize. As the tumor in the esophagus demands more resources from the body, it leads to fatigue. Additionally, cancer disrupts the body's ability to absorb nutrients, which further contributes to weakness. Fatigue is a common symptom in cancer patients, and it can worsen as the cancer progresses. Sign number 8, getting full quickly. If you find yourself feeling full after just a few bites of food, it could be an early sign of esophagus cancer. Scientifically, when a tumor grows in the esophagus, it causes a sensation of early satiety because it blocks the passage of food. As the tumor grows, it partially obstructs the esophagus, making it feel full even after consuming only a small amount of food. This can lead to poor nutrition and weight loss as you're unable to eat normally. Take steps now. Being aware of early esophagus cancer signs, assess your risk. Don't wait if you spot any of the symptoms we discussed. Early diagnosis and cure can turn your life around. Discuss with your healthcare provider if you face swallowing difficulties, constant heartburn, mysterious weight loss, and other worrisome signs. Recall, awareness is your best defense against this silent threat. Please like and subscribe if you found this useful and share with those who might benefit. Your support helps heighten awareness and save lives. Thanks for tuning in, and see you next time.